back on the record. The time is 12:35 p.m.
Doctor, I believe you earlier testified that in your experience as an emergency room physician, you have seen patients in the emergency room who have sustained injuries to the internal structures within a patient's knee. Is that fair?
Objection, form and foundation.
In the emergency room setting, we usually do not diagnose those injuries per se. We say that there is an injury to that joint, and we can suspect that, but we can't diagnose that in the ER. That's done during follow-up when they get an MRI with the specialist.
But in your experience, have you seen patients that have come through the ER who have had injuries to the internal structures within their knee, such as ligaments, tendons, and muscles? Have you seen that in your practice?
Objection, asked and answered.
Objection.
I can't say for sure whether those were injuries. Those are suspected injuries, so no, I can't say that they've been diagnosed in the ER, no.
Okay. Have you diagnosed suspected injuries to the internal structure within a patient's knees before?
Objection, form and foundation.
I don't know what you mean by that.
No. Have
I
you ever
diagnosed suspected injuries.
Right.
The only thing we diagnose in the ER is whether it's a fracture, other things that we can treat within the emergency room setting.
So you only diagnose fractures and other things you can treat within an emergency room setting. Is that correct?
That is what I said, yes.
Okay. What are the other things, particularly in Mr. Tolson's case, that could have been treated within the emergency room setting?
I'm going to object to form and foundation.
Same objections.
Everything that Mr. Tolson needed to be treated was treated in that setting.
Could the injuries to the internal structures of his knee have been diagnosed in the emergency room setting?
Objection, form and foundation.
I'm going to object to as form and foundation and could call for expert testimony in the field of orthopedics, but you can.
During that visit that I saw Mr. Tolson, he had no evidence of any internal destructive or limb-threatening injuries during that visit.
And what would some of that evidence be? What would some of the symptoms that you would expect to find from a patient who had injuries to the internal structures of his knee, and also injuries that would prevent him from moving his foot? What would the type of complaints that you would expect to see or find?
I'm going to object to form and foundation. And again, you're assuming that diagnosis is made in the emergency department, which he's repeatedly said they're not.
You can answer the question, Doctor.
Yes,
Objection to form and foundation. Sorry.
Again, in the ER, we're looking for limb and life-threatening injuries. We're not looking to diagnose specific ligament injuries.
But you said in this case there was no evidence that
Of
you
any-
found of any internal destruction process of the ligaments, structures within his knee.
I did not say that.
You did not say that?
No.
Okay, what did you say there was no evidence of?
I said Mr. Tolson had no evidence of any life or limb-threatening injuries when I evaluated him that day in the emergency room.
Okay. What would be some of the evidence or symptoms of a limb-threatening injury?
Object to form and foundation.
What would be, say it again?
Right. What would be some of the evidence that you would consider evidence in a medical setting that would suggest a limb-threatening injury?
Can you narrow that down?
In this case?
Objection.
Wait, you want to test her to tell you what evidence that wasn't there would have been there in the same situation?
Ma'am, did you understand the question?
No.
I'll ask it again. You said there was no evidence of any limb-threatening injury, okay? Is that your testimony?
In Mr. Tolson's case, he had no evidence of any significant other injury
Any significant? Okay,
or
so...
limb-threatening injury.
Why don't you just ask her what
Hang
she's
on a
basing
minute.
that on?
I'm gonna ask a question, so hang on 1 second. All right, so let me understand your testimony again. There was no evidence in this case that Mr. Tolson had any significant or limb-threatening injury when you saw him. Is that a fair statement?
Objection.
In Mr. Tolson's case, when I evaluated him, he did not have any evidence of any limb-threatening injury based on my findings at that visit.
Okay, so because you said he had no evidence of a limb-threatening injury, then obviously you know the signs and symptoms of a patient who presents with a limb-threatening injury, correct?
Objection to form and foundation and the general nature of that question.
In the emergency room setting, when we speak of those type of injuries, we are speaking of things having to do with anything that might cause them to lose that limb, which he did not have.
All right, what are the things that you would be looking for that would suggest to you that he had a limb-threatening injury? What are you looking for? What are the signs and symptoms?
Same objections.
Okay. You're looking at the circulatory system.
Is that it?
You're looking for serious fractures. But again, not,
All right, so the evidence of it that you would be looking for in the circulatory system that might suggest a limb-threatening injury would be a reduction of blood flow to the limb itself. Would that be a fair statement?
Check to form and foundation.
in the emergency room setting, that would be a fair statement.
In order to check to see if there's a decrease in blood flow to the limb itself, there are various ways to check that. True?
In the ER, if you check a patient, and the ways that we do it in the ER is we check for circulation by checking pulses, which I already stated I check for.
You used one method to check for pulse, which is you put your finger on the patient's artery and see if you can feel a pulse on the patient's artery through the skin, correct?
Yes, and that's correct, and that's what we do.
That's one way of doing it. Isn't there another method an emergency room doctor such as yourself can utilize if she believes there is a reduction of the blood flow into the patient's leg, such as a Doppler study?
Objection to form and foundation.
Objection, form and foundation.
There may be, but Mr. Tolson did not need a Doppler study. He did not warrant one. He had good pulses. It was not warranted in this setting.
So if physician assistant Krupa believed that Mr. Tolson had a decrease in blood flow to his ankle or leg, she could herself have ordered a bedside Doppler test, correct?
Objection.
And you're asking me to comment on something that didn't happen. She did not detect any decreased blood flow.
No, you haven't spoken to her yet, correct?
Well, I remember the case. I was there. I have not spoken to her.
Okay, now let me go back. If she thought, in this case, that Mr. Tolson had a decrease in flow of blood to his lower leg, his foot, she could have ordered a bedside Doppler study. Would that be a fair statement?
Objection.
Check to form and foundation and the hypothetical.
Yeah, he did not need a Doppler study of his leg.
But you didn't answer my question, and I'll ask it again. It's a very simple yes or no.
Yeah.
If physician's assistant Krupa had thought or believed or had any question that Mr. Tolson had a decrease of blood flow to his leg or foot, she could have ordered a bedside Doppler study to check that out.
I'm going to just object to the Foreman Foundation.
Same objection.
This is something she would have discussed with me first.
Could she have ordered it on her own?
Did she have the authority at St. Agnes Hospital, do you know, or within her scope of practice to order that test on her own?
Yeah, she could have ordered it on her own.
Okay. And if you yourself believed that Mr. Tolson had a decrease of blood supply to his leg or foot, you yourself could have ordered a bedside Doppler study, correct?
If it was warranted. It was
Now-
not warranted in his case.
Okay. Now, one of the things that would warrant a bedside Doppler study would be if Mr. Tolson presented with a cool or cold foot, correct?
Object to Foreman Foundation and
He did not.
hypothetical.
He did not present with a cool and cold foot.
If he didn't answer my question, I'll ask it again. One of the reasons that a physician's assistant or doctor such as yourself could order a bedside Doppler study would be if a person presented with a cool or cold foot. Would that be one of the reasons for ordering it?
Same objection.
It really depends on what the whole presentation of the patient. That is not how he presented at all. It really depends.
Well, if Mr. Tolson's foot was cold to the touch, when you examined it, would not you have ordered a Doppler study?
It depends on why it was cold to the touch.
Well,
It depends on the whole picture, and that was not his picture.
so let me get this straight. If you examined Mr. Tolson's foot and you found his foot cold to the touch, you would still not have ordered a Doppler study? Is that your testimony?
I'm not saying that
Objection.
at all. I'm saying it depends on the situation.
What other part of this situation would it depend upon? What else would you need yourself in order to order a Doppler study if his foot's cold? What other symptoms and signs would you need to see before you would order that test?
The whole clinical picture.
Well, you gotta
How,
t-
the history, the
You have to tell
physical,
me.
how
Yep.
it happened,
Yep.
would all have to be put together.
Tell me what else would you need before you would reach that conclusion that you needed a Doppler? What else would you have to
I
see?
just told you, the history, the
Tell
the
me the
mechanism
history.
of injury, the whole history and physical exam, everything gets put together. You can't just isolate that, and say, would you order a test in this instance? You can't do that. You have to look at the whole picture. And in his case, that picture did not fit that profile at all. He did not have a cold and foot.
Is a cold foot one of the symptoms of a decrease in blood flow to the person's foot?
Objection to Foreman Foundation. You mean, can it be?
It can be. It's also the symptom of a lot of other medical illnesses, too.
Okay. What other medical illnesses can you think of in this case that would explain Mr. Tolson's foot to be cold to the touch?
Objection to Foreman Foundation, and that misstates the record, but go ahead.
Yeah, it was December. I mean, could have been out in the cold. I cannot comment on that because this was not the case with him.
Okay. Yeah. Would numbness in the extremity be an indication of a lack of blood supply to that extremity?
Not by itself, no.
Is it one indication?
It could be an indication, but
Okay.
not by itself, no.
And
It's the
how
whole
do you-
picture.
Please,
And
sir,
how-
please.
okay.
Were you finished?
It's the whole clinical picture. You can't isolate these things by themselves. You're
Okay.
trying to get me to comment on one isolated finding. You have to look at the patient and take everything in consideration.
Right.
So I
And-
can't comment on those hypothetical situations because you're not giving me the whole patient, what the patient looked like, the history, how they presented. In
Well-
his case, that I know, that's the history that I have. That's not how he presented. There's no test that was warranted to check other than me checking for his pulses.
Did he complain of numbness?
Not to me, no.
Is it in the chart?
I don't know, is it? Did you look?
Did you look? Didn't he complain of numbness? I mean,
He did not complain of numbness to me.
you approved.
He had good sensation on my
Okay.
exam.
Did you approve the care that Ms. Krupp authorized for Mr. Tolson without reading his chart?
I approve the care after I examine the patient and talk to the patient.
And that's without reading his chart, correct?
No, I didn't read his chart initially. I went straight to the patient, straight to the source.
So then you were unaware that he reported numbness and paresthesia when he entered into the emergency room, correct?
Objection. Form and foundation misstates the record.
I'm sorry, did I misstated the record? Go to page 8. Counsel just said I misstated something, and I want to straighten this out right here.
Well,
okay?
my problem with your question is
Page
when
8,
you
ma'am.
came into the emergency department. If you
Pa-
take that out of your question, it's fine.
Page 8. Do you see on there where it says positive for numbness and paresthesia?
I can't read all that writing, but that's what it looks like it says.
Okay, so now, he comes into the emergency room department, and it looks like the time is 4:09 to the left there. Do you see that?
Or 4 o'clock, I don't know.
Yeah, 4 o'clock. At that point, he complained of numbness and paresthesia. You were unaware that he had made those complaints when you examined him. Would that be fair?
Objection to form foundation.
Where does it say comes into the emergency department?
Ma'am, is this an emergency room record at St. Agnes Hospital?
This is a copy of the record, yes.
Right. The time there is either 4 o'clock or 4:09, correct?
Mhm.
So can we agree that he's in the emergency room at that time?
Just so you're clear, my issue with your question is you're making it sound as though that was his presentation or that's what he complained in when he first came into the emergency department. So if you could just clarify that, we'll be fine.
I'm going to continue answering the questions. On page 8 of the record, is that a page from St. Agnes Hospital emergency room?
8.
That is a copy of it, yes.
Does the time say either 4 o'clock or 4:09?
That's what it looks like.
Can we agree that he's in the emergency room department on December the 3rd, 2009, either at 4 o'clock or 4:09 in the afternoon?
According to this, yes.
Can we also agree at that time he complained of numbness and paresthesia?
Objection?
Objection.
That's not what it says.
Foundation.
It says positive for numbness and paresthesia. Does that indicate to you that he complained of numbness and paresthesia?
Objection?
Objection.
It doesn't say he specifically complained of that.
Okay. How do you interpret the word plus, little plus sign near numbness, and plus sign in front of paresthesia? How do you, as an emergency room doctor, interpret that note?
That history couldn't be gotten not directly from the patient.
How do you interpret that note, though? What does that note
It
mean
doesn't-
to
it
you as a
doesn't-
doctor?
It doesn't tell me anything about where or what he said. It's just 2 words there.
Okay. Numbness means some part of his body was numb. Would you agree with that?
Yeah, I would agree with that.
Okay. Paresthesia, is that another way to saying you can't move a part of your body?
No,
Okay.
Objection.
What's paresthesia mean to you in medicine?
it's not what it means to me. Paresthesia means altered sensation.
Altered sensation. Okay. Now, when you examined Mr. Tolson, you were unaware that in the chart there was the notation of numbness and paresthesia. Would that be a fair statement?
I did not read the note here before I went to talk to the patient myself.
Is that a yes? That you were unaware of that?
I wasn't aware of it even after I spoke to him. That's
Yeah.
not what he said.
What are some of the tests that doctors such as yourself can use to test whether a patient's limb is numb? Depending upon where it is, are there some general tests you can use to establish or test numbness in a patient's limb?
First of all, the patient has to, he would say something. When I interviewed Mr. Tolson, there was no complaints of any numbness. When I examined him, he could feel me touching him. He could move his toes, his foot, his ankle. There was no evidence of that.
That's not the question. My question was, what are some of the tests that a doctor such as yourself can use to determine what part of a patient's body is numb on the lower extremity? What are the tests that you can use?
You touched him.
Touch?
Mm-hmm.
Okay, just with your finger?
Yep, just with your finger.
You don't use sharp and soft methods?
In the emergency room,
You don't?
we don't go there.
Okay. And how do you test for paresthesia?
Seeing how paresthesia includes numbness, it would be the same thing.
Same thing? Yeah. Is the combination of numbness, paresthesia, inability to move a foot, and a person's foot being cold to the touch, would those be enough signs for a physician such as yourself to question whether there was adequate blood supply to the patient's limb?
Objection to form foundation.
Again, you're not looking at the whole picture.
What else would you need to know other than those things that I just told you to raise a question of whether or not there was adequate blood supply to his foot?
Same objection.
Same objections.
In the emergency room setting, if patient complained of numbness, this patient had pulses, so that, I mean, you didn't say anything about pulses. If they have pulses, the whole picture has to fit. Numbness alone doesn't do it. Coolness doesn't do it. They could be for many other reasons.
Okay. But I asked you, in addition to numbness, paresthesia, inability to move the foot, and temperature, the skin being cold to the touch, what else would you need as a doctor that would cause you to think that perhaps there's an inadequate blood supply to the patient's limb?
Objection to the hypothetical.
Objection to foundation and to the hypothetical.
I mean, if I checked his pulses and he had pulses, that kind right there, that kind of makes me think it's that he has adequate circulation.
Okay. So once you checked his pulses with your finger, then that was enough for you to render a determination that he had adequate circulation to his limb?
No, I did
Objection to
not
form
say
and
that.
foundation.
Okay.
No.
Uh,
I said the whole picture, everything together, pulses, I checked his system for sensation, I checked the movement, all those things together added up to he had adequate circulation.
Did you prescribe the crutches and the leg brace for Mr. Tolson?
Probably the PA went ahead and prescribed those.
Okay. And ma'am, when did you actually sign the report where you approved of the care and treatment provided by Physician's Assistant Krupa?
On the 13th.
That was 10 days later?
Mhm.
Is there a reason why you waited 10 days to sign the report?
Objection to form.
I didn't wait 10 days. The chart probably got taken away before I got a chance to sign it.
The chart was taken away from you before you had a chance to sign it. Is that why you didn't sign it for 10 days?
Objection to form.
No.
Okay, you said probably was taken away. What are some of the other reasons why you didn't
Sir,
sign the
we
chart for
sign
10
a lot
days?
of charts. We sign charts, and sometimes in the process of the chart going through the emergency room, it gets taken and they don't check to see whether we've signed it or not, and it gets put in our mailbox, and you know, by the time I go to my mailbox, it was 10 days later.
Is there a reason why you didn't sign it while he was in the emergency room right after you
I
examined
would
him?
have had it been presented to me before it was taken out of the area.
I don't understand why a chart for a patient who was in the emergency room, who you were examining, who was prescribed medication, would be removed from the emergency room and not available to you as his treating physicians. What circumstances does that happen?
Because I saw the
Objection.
patient. They knew I saw the patient, and I saw the patient with the PA, and she knew that it was okay to let him go once I've seen him. Whether the chart got signed or not, it doesn't make any difference. You know, I saw the patient, I remember the patient, and somehow the chart got put to the side and or put into medical records without me signing it. When they review all the charts that need to be signed, some are, it's an oversight, but me signing the chart doesn't negate any medical care that he got, doesn't negate the fact that I examined him.
In your normal practice, do you sign patients' charts after you see them in the emergency room on the same day?
If, in the emergency room, if I see the patient by myself, I sign the chart, but even then, the chart may not get signed for some reason. Have you ever been in the emergency room where it's busy and there's lots of charts and lots of paperwork?
Well, I'm just, do you know?
Sometimes things don't get signed right away.
Can you give us, or do you know why this chart was not available for you to sign when Mr. Tolson was discharged from the emergency room?
Oh, I
Objection to form and foundation. Don't
Objection.
speculate.
can't tell you
form.
that.
Do you know why?
I
Okay,
can't
so then
tell you
then if you don't know why it wasn't available, then you can only speculate as to why you didn't get it for 10 days later, correct?
Objection.
Well, I'm not going to speculate. It just, I didn't get it for 10 days later.
Okay.
Or I didn't go to my mailbox, or
Well,
I don't know.
How was it brought to your attention that the chart wasn't signed by you?
I don't remember. I don't remember.
Well, you remember that Mr. Tolson came back to the emergency room for treatment, correct?
I found out when I came back to work.
Yes. And who told you, and what did they tell you?
I don't remember the exact words, but the doctor there told me.
What did he tell you? You don't know?
He told me,
Objection.
that he came back for treatment.
Is that when you decided to look for the chart to see whether or not you'd signed it?
Nope.
Okay. What prompted you? How did the chart get? Do you have any idea how the chart got back in your possession for you to sign it?
I don't recall.
Who makes the decision as to what forms to use in the emergency room, what forms to fill out for the patient's evaluation?
Objection to form foundation. I'm not sure I understand the question even.
Doctor, do you understand my question?
I don't know the answer to your question, sir. Who decides what forms are used? It would be, I could only speculate, it would be the administration.
If you're only speculating, then
Okay,
don't
I'm not going to
speculate.
speculate, but I don't know.
You're required to supervise physician's assistant Cooper, correct?
Yeah, I'm not required to make the forms and
Okay.
decide which forms are done.
Part of your supervision, would you agree, is to make sure she uses the right forms to go through the checklist for the analysis of the patient?
Objection to form and
Objection.
foundation.
That doesn't make any sense to me.
Don't make any sense to you?
You know why? Because I'm responsible for clinical care of the patients and the clinical aspects, not for the forms and the paperwork and stuff. Yes, she has to fill out a medical record sheet, yes.
Right, because as all physician's assistants who take over the care of a patient, they're required to accurately chart the examination they perform and the findings. Would you agree with that?
Objection to
object.
form.
And I'm also going to object because I think now your questions call for expert testimony. She's not here as an expert to comment on the reasonableness of Ms. Shaw's care and treatment or documentation in this case as an expert witness. So if you rephrase your question, it might be permissible. Don't answer that question as phrased.
Ma'am, can you tell us if there are any continuous supervision mechanisms that you follow when you supervise a physician assistant at St. Agnes Hospital?
Objection.
Form and foundation. Do you understand the
I don't really understand what you mean by continuous supervision.
Mechanisms? You don't understand that concept?
I don't understand what you're saying now.
Okay, all right. Now, how do you evaluate the physician's assistant's performance in the emergency room at St. Agnes Hospital? How do you know whether or not they're implementing the right procedures, doing the right testing for the patient in order to meet the patient's needs?
objection to form and foundation?
We're right there with them. We're in the emergency room with them.
Well, you weren't with Ms. Krupa when she first examined Mr. Tolson, correct?
Oh, see, you're being...
Is that true or not? Were you with her when she did her initial examination?
I was in the urgent care department working with her, yes.
Were you in the room when she performed the physical examination?
I don't have to be in the room with her.
Just don't argue it. You got to wait till I ask the question, then you can answer it. Were you in the room with her when she physically examined Mr. Tolson?
I don't think so.
Okay, now, then how do you know, if you weren't in the room with her, that she performed all of the necessary tests for Mr. Tolson in light of his condition?
When I go in to examine the patient, I make sure that everything that needs to be done for that patient is done. If there's something that I think that the PA has not done, then I bring that up for them to do.
Okay.
I check it because I check it myself as to what was done. And I don't really know what you're getting at there with that question.
What I'm getting at is, if you weren't there when she examined Mr. Tolson and didn't look at the chart to see what notation she made of the physical examination, then how did you know that she did the right examination of Mr. Tolson?
Because I examined him myself.
Okay, so it's solely based upon your examination. Is that correct?
Objection.
I don't know what you mean by that.
You don't understand my
I
question?
don't understand what you're getting at with that.
Okay.
It's solely based on, I'm telling you, I examined the patient myself.
Right, I know you did the examine.
Krupa discussed the patient with me.
Right there.
I know you examined the patient yourself, but
Krupa discussed the patient with me. She discussed her findings with me. We discussed the patient and what was going on with the patient.
What-
Okay? It's not like she went off in a corner and examined the patient in private and I didn't know what she was doing.
what did she tell you about her findings?
She told me that the gentleman had an injury to his knee. Something hit his knee. She was getting x-rays. She examined him. His neurovascular status was intact.
Did you ask her what tests she used to determine that his neurovascular status was intact? Or did
No.
you just take it at her word?
You know, I didn't ask her every test that she did on him because I went right behind her and did the testing myself. If she, she tells me that she did a test on a patient and I check behind her, I'm not going to question as to, what every single test that she did to the patient. She's already reported that off to me.
When you undertook the supervision of physician assistant Krupa at the hospital, did you sign any written confirmation that you understood your duties and responsibilities for the supervision of Ms. Krupa?
Objection.
You just need to be more specific because there's the concept of supervising her on this shift versus overall supervision of her as a PA in her practice.
Did you understand my question?
Could you be more specific, please?
Before you supervised Ms. Krupa, I'm sorry, when's the first time you supervised her?
I don't remember.
This wasn't the first day though, correct?
This was not the first day.
And you had worked with her, would it be fair to say, many times in the emergency room at St. Agnes Hospital before December 3rd, 2009?
I have worked with her in the urgent care department at the hospital several times before.
Okay. And when you agreed to supervise her in the urgent care department, did you sign a written confirmation to that effect, that you understood your duties and responsibilities for her supervision?
I'm going to
Objection.
object. Again, you're missing the foundation. You don't have the proper foundation for that question.
It doesn't work like that,
Okay, tell me how
What kind of agreement are you talking about? I mean,
I'm
was
wondering
her
if-
supervisory physician for that day in the ER. I didn't sign any, sign a form to say I'm supervising her whole career. No, for that day, I was her supervisory physician.
Right. What I'm trying to figure out, did you ever sign any written confirmation at any time you supervised her that said that you understood your duties and responsibilities as a supervisor of this physician's assistant?
Again, same
Objection.
I'm also going to object to the term written confirmation.
Go ahead.
I don't know what's on her supervision agreement.
Did you ever sign the supervision
I
agreement?
can't say that I did. I don't know what's on there.
All right. Do you agree that as a supervising physician, you are required to accept responsibility for the medical care that is provided by a physician assistant such as Ms. Krupa?
Objection, form and foundation.
I'm only responsible for the medical care while I am working with that PA in that particular time.
Is that a yes?
That's a yes to I'm only responsible for what I am when I'm working with them in that particular time.
And did you believe that Ms. Krupa had the education, training, and level of competency to provide adequate care and treatment for Mr. Tolson in this case?
Objection.
Are you asking me to give an opinion as to how good a PA she was? Or, I mean, I don't know what you want me to do there.
Yeah.
You want me to critique her skills, or what do you want me to do?
I thought, correct me if I'm wrong, but I thought one of the basic things when a physician yourself agrees to supervise a physician assistant such as Ms. Krupa, that you have to have an understanding of her education, training, level of competency before you allow her to treat a patient in the urgent care department. Would you agree with that?
I'm going to object to form and foundation and your gross misassumption, but
Krupa was not
Same
hired by
objections.
me. She wasn't hired by me. She was hired by the hospital or M-Care. You need to ask them what they checked, what credentials that they reviewed and checked. That's up to them.
But, so then, would it be fair to say you did not have an understanding of her level of education, training, and level of competency while you worked with her at the hospital?
Objection.
objection to form and foundation.
Again, you have, you know, if a person is cleared to work there, then those things are checked by the people that hired them.
But you didn't have an independent understanding of her education, training, and level of competency. Would that be a fair statement?
Objection.
I really don't know what you're asking me there. I know that she's trained as a certified physician assistant, okay? I didn't go through her background, or that's done by the people that hire her, not me. She wasn't working for me.
Okay. And you can tell me one way or the other. Do you know whether or not, on this day when she treated Mr. Tolson, whether she had the education, training, and level of competency to provide adequate care to him from your own personal knowledge?
Objection. I don't want you to comment on her adequacy as a physician's assistant beyond what you've already testified to.
Yeah, she had the skills to work in this setting. She had the training to work in this setting.
Is that based upon your own evaluation of her, or just from the fact that the hospital hired her and placed her in the ER to work with you?
Objection, form and foundation, and by misstating who hired her.
Same objection.
I mean, based on documentation that she brought to her employer, she's certified to work as a PA, okay? Personal experience with her, I don't know if I should, I mean, she's,
You're unable to comment on that?
I can't comment on it. I mean, she's,
Okay, that's fair. All right. It's page 3 of the record, marked as exhibit number 5.
And what is that, the triage note, or? I don't have the same
Oh.
numbers. Oh, okay.
What is it?
It's this scribble.
Thank you.
this,
No.
Page
Oh, it's
3.
not?
Page 3.
yes, it said page 3. Oh, no, it's page. I don't have page 3.
It looks like this, I think.
Oh, you know what?
don't
That's
have
because I
page-
took it out and marked it.
Oh,
Oh,
My fault, I apologize. Now, let's go back to my question. Do you have in front of you exhibit number 5? Okay, have you seen that form before used in the urgent care center at St. Agnes Hospital?
this is not one of the forms that doctors use.
I'm asking you if you've seen that form before at the urgent care center at St. Agnes Hospital.
I may have, I don't
Okay.
remember
Do you
this
know-
form.
hold on. Go ahead and finish your answer.
I said, I don't remember this form. Yeah. This is not a form that the doctors use.
Is it a form that the physician's assistants are supposed to use when they do an evaluation of a patient?
Objection to your term supposed to use.
Right.
She's just testified she's not familiar with this form.
Doctor, you worked at St. Agnes Hospital for 7 years, and you've never seen that form before?
Objection.
There are so
Objection.
many forms, and this is not a form that PA would use. This is not a doctor form. I recognize that it's not.
What type of form is it? It's contained in the emergency room record, the chart for Mr. Tolson. Can you tell me why it's in his chart if it's not a form that doctors use?
Don't
Objection.
speculate. She's testified she's not familiar with the form. I don't know where you can go from that.
I'm not familiar with that. I mean, I don't know. I don't remember that form.
Do you know why that form is in his chart? And
Objection.
You
Ask
gotta let
and
me
answer.
gotta let me finish answering the question
Okay,
before you object.
I'll let you finish answering, asking
Thank
the
you.
question.
Do you know why that form is in Mr. Tolson's chart if it's not one of the normal emergency room forms?
Objection to form and
I can't answer
mischaracterizes,
that question.
mischaracterizes the testimony, lack of foundation.
Also calls for speculation. She's
You
not
can answer.
familiar
Do
with
you
the
know or
form.
not?
Same objections.
I cannot answer that question. I
Okay.
don't know. I can't answer that question.
When you signed off on this chart 10 days later, did you review the entire chart?
I knew the patient. So, you know, and I remember her presentation to me. I remember the actual events that happened. I may have looked over the chart, yes, but I remember the exact events that happened.
So is the answer you did review the entire chart when you signed off on it 10 days later?
You're asking her if she recalls or if that's her practice.
I don't recall whether I looked through the whole chart or not. You know, since I remembered the patient, I didn't really need to go through the whole chart.
If you went through the chart and saw exhibit number 5 in the chart, that page that's right in front of you that has this line across it that wasn't filled out, would you be curious as to why that document is in Mr. Tolson's chart but not filled out?
Objection to form, lack of, and foundation.
Same objection.
You know, that form has nothing to do with our care, the provider's care.
Okay.
I don't know if that, you may need to ask
Do you
people
know
who are in
who
charge
wrote,
of the charts.
do you know who wrote the X or the lines on that chart?
I don't know.
Thank you, Doctor. Doctor, if you can go to page 19 of the chart. And it's a square box. It says Emergency Department Management, Patient Record. The date is 12/3/09. The time, I think it's 16:04. It says page 1, where it says stated complaint. 1 is leg trauma. It says priority 3, severity 9. Are you there, doctor?
This page here?
Yes, ma'am. 19.
That's not what
Get away from us. No,
Oh, you have it.
it's after that. I think that's it. Got it. Okay.
Thank you.
Okay. Can you tell me what the number 3 next to priority means?
that's not paperwork that I fill out.
Can you tell me what the number 9 next to severity means?
I cannot.
Doctor, you indicated that one of the examinations you performed on Mr. Tolson was skin temperature? Is that
Yes.
correct? Okay. What was the temperature of his skin? Was it, how did you note that? Did you note what his temperature was, whether it was warm, cold, clammy, dry, cool in the chart?
I think I've told you that it was warm to the touch. It was not cool and clammy.
Did you make a note of that anywhere in the chart?
No, I didn't make a note of it myself, no.
Was there a place in the medical chart that you could have made a note as to whether his temperature was cold, warm, dry, anywhere in this chart?
Objection.
I mean, if I were seeing this patient myself, you know, I would have notated that, but I suppose there's a place you can put it anywhere if you want.
And if Ms. Krupa had done the same examination of you, because she was seeing the patient, would she be required to make a notation of the color, the temperature of the patient's skin in the chart?
Again, I'm not going to have her testify as an expert witness on the standard of care of a PA. So to the extent your question asks what is required of her, I'm going to tell her not to answer that question. If you rephrase it, maybe it'll work.
Well, hold on, doctor. You are required to supervise the physician's assistant in this case, particularly Ms. Krupa, correct?
When she is working in that setting with me, I am her supervisory physician at that time.
And part of that is you have to know what is required of her for the patients that she's treating, correct?
Objection. That misstates improper foundation. Go ahead.
Is that true?
I mean, it's too, in general, if you want to know in general, then what's required is to take care of the patient.
No,
That we make sure that the patient is taken care of appropriately, and that's what was done.
But what I'm asking for is what is required in this case for Mr. Tolson.
In terms
Now-
of filling out forms?
No. What I'm asking for is you are certainly aware of what was required of her for the care of Mr. Tolson in this case, correct?
I'm required what's appropriate for care of any patient that comes in, and Mr. Tolson was taken care of adequately.
Okay, now, as part of that, does it require Ms. Krupa to note the temperature of Mr. Tolson's skin if she actually felt his skin? Was she required to write that in the chart?
I'm going to object because you haven't laid a foundation that her supervisory responsibilities include knowledge of what a PA is required to fill out at St. Agnes or under the standard of care.
Are you going to tell her not to answer the question?
Yeah, because you haven't
Okay.
laid a proper foundation that this is an appropriate question for a fact witness to answer.
Doctor, in this case, you examined Mr. Tolson, correct?
Yes, I did.
And you believed that what was required of you was to determine the temperature of his skin, which is why you felt it and concluded it was warm to the touch, correct?
Correct.
Would Ms. Krupa be required to do the same thing during her evaluation?
According to what Krupa reported to me, that is what she did.
And should that be written somewhere in the chart?
Objection. Again, it calls for her to render an opinion on what's required of a PA in terms of documentation.
Exactly, and this is the lady you're supervising. What, as far as your supervision of her, did you expect that she should have made that notification in the chart?
I would expect her to give me the correct presentation for the patient and treat the patient and not treat, the stuff that was written per se. We treated the patient, we looked at the patient, and her presentation to me included those things.
You didn't answer my question. My question was, in this case, did you expect her to make that notation regarding the temperature of Mr. Tolson's skin somewhere in the chart?
Objection. You can answer that question.
The only thing I expect her to do is present the patient appropriately and let me know that proper care was done with the patient. Once that presentation is done and I evaluate the patient and we agree with each other, then that is what matters for the proper care of that patient.
So is that a no?
I'm not saying no or yes.
Do you know what Mr. Tolson's level of pain was after he was given the 1 milligram of Dilaudid and the Toradol?
I don't recall.
Do you have any recollection of any conversation you might have had with anyone who accompanied Mr. Tolson to the emergency room?
No, I don't.
Do you know how long it takes for tissue in a patient's leg to become ischemic if they do not have an adequate supply of blood?
Objection of form and foundation.
I can't give you any specific time.
Can you give me your best estimate?
Objection.
I shouldn't estimate.
No. Okay. Doctor, I'm sorry, you don't remember looking at the x-rays, correct?
Correct.
Have you provided me all the opinions that you have in this case and intend to give a trial and explained all the reasons behind your opinions?
Objection. That calls for attorney-client privilege. Attorney work product doctor will designate experts next week per the scheduling order. And whatever opinions Dr. Jackson may have would certainly depend on what's asked of her.
Are you telling her not to answer the question?
Yeah, I am.
That's all the questions that I have.
I have no question.
I just have two points of clarification. Dr. Jackson, Mr. Gaston asked you whether or not you were provided with any documentation from N-Care about the, I think he said care of patients. Do you recall that line of testimony?
Yes, I recall.
Okay. Did N-Care provide you with any policies or procedures or documentation that directed you how to work up, examine, treat, or otherwise render medical care to patients?
No.
Okay. Now, I want you to take a look at Dr. Bang's radiology report in the chart.
What number page is that again?
It's 20 in mine. It might be 21 or so in yours. Yep, you almost had it.
24.
Thank you.
Okay.
All right, I want you to look at the bottom under Dr. Bang's electronic signature where it says dictated and transcribed. Do you see that?
Yes.
Okay. Are you familiar with the concepts of dictation of reports and transcription of reports and medical records?
Yes, I am.
Okay. You'll see under transcribed, it says December 4th, 2009 at 07:24. Do you see that?
Yes.
Okay. Does that assist you in any way in determining whether or not this actual signed report from Dr. Bang was available to you in the emergency department while you were caring for Mr. Tolson?
It shows me that it was not ready.
Okay. And
This
so
actual report.
I'm sorry. So the results that you received from the x-ray interpretations of Mr. Tolson's lower extremity were through some preliminary reporting, is that right?
Yes.
That's all I have, thank you.
Do you know if the preliminary report made any comment on the joint effusion, the fluid in the knee or not? Do you recall that?
I don't recall.
Would that make any difference at all on your interpretation of the report or any other course of action that you may have prescribed for Mr. Tolson?
I can't say. Again, based on the facts that I had at that time, I can't say.
Can't say what? Whether it would have had an effect or would not have had an effect?
You mean the fact that he may have had an effusion?
Right, effusion fluid in the joint. Would that have a bearing one way or the other on how you treated him or whatever test you might have recommended for him?
Just objective form and foundation.
I am too.
I
Objection
mean,
to form.
I really can't say without putting it in through the whole case. But an effusion alone doesn't, indicate any limb-threatening problem.
Does it indicate recent trauma?
Objection.
Possibly.
Okay.
Or we
And
could have it from some other reason.
if you had that information that there appears to be mild, moderate left knee joint effusion, would you have done anything differently?
Objection asked and answered.
Objection
She just
asked and
answered that.
I'd have to, put it back in context of that whole day,
Well-
of that day that he was treated. I can't say.
Well, I want you to put it back in context of that whole day. You have the whole record in front of you. You have your memory. Now I'm giving you an additional piece of information that,
Is it old or is it new effusion? Did he have pre-existing arthritis? I mean, all that has to be taken into consideration.
okay, so those would be some additional questions
It's
that you
not
would
a
want.
limb, it's not a limb-threatening problem.
So those would be some additional questions that you would want the answers to.
Not necessarily, because in the setting of the emergency room, an effusion is not a limb-threatening problem.
Is joint effusion some indication of trauma?
It can
Objection
be.
asked and
It
answered.
can, it can be. In this case, were you able to rule in or out whether the effusion that's noted on the ER was from recent trauma or from some other source?
Objection. Don't
There's
answer.
no way.
Don't answer that question because now he's just assumed you had that piece of information, which
Well, you have to tell me whether you did or did not, because if you had the information about the effusion, then it's an appropriate question. If you didn't, and you didn't know about it, that's another thing.
yeah, but you asked her and she said she doesn't remember.
Well, then,
And
but,
she-
and
You already
that,
answered that.
yeah, and that brings me to the next question. You don't remember one way or the other whether you were advised that he had joint effusion, okay? So now I have to explore, if you were aware of it, would you have done anything differently?
Objection asked and answered. Same
No, she didn't.
objections as
I
before.
can't say.
Can't say?
I'm also going to object because she also testified that the findings that are in the chart are more likely than not the ones that she was given at the time she cared for Mr. Tolson. By the chart, I mean the handwritten interpretation.
Well, are you able to determine effusion on a plain film x-ray, doctor?
I'm not a radiologist, those type of things are best determined by a radiologist.
Is that a no, you're unable to do it?
I'm saying that I can't say that I would pick one up every time, but it's a radiology thing. I mean, I'm not the specialist in the emergency room setting. That is not a limb-threatening problem.
So you would defer to a radiologist for his or her opinion on the presence or absence of effusion that may show up on an x-ray. Would that be a fair statement?
I would defer to the radiologist, yeah. He's the expert.
Okay. That's all I have.
Okey-doke. We'll read and sign.
This marks the end of the deposition. We're going off the record. The time is 1:35 p.m.